Good evening. This is Christine Geary with Nursing Administration and Management Practicum 2 with Professor Christina Tedesco. And this presentation is about teaching tools. My presentation is regarding infectious disease and nurse call script for donor centers. My objectives are to utilize a PowerPoint presentation to show to the donor-centered nurses why it is necessary to follow up with the phone call when donors already have been notified via certified letters that they have positive infectious disease markers. The objectives on the PowerPoint presentation are review the process of testing the whole blood and platelet donors for infectious disease markers, review the process of receiving positive infectious disease markers, and review the process of notifying the donors of their positive infection status. Ensuring the safety of the blood supply for the recipients is the utmost importance. However, it is equally important to treat the donors with respect, dignity, and care of their health and needs. Donors who volunteer, donate their blood and time, they deserve same consideration as the recipients of the blood products. My projects addresses the need to follow up a process to contact the donors if their test results showed positive infectious disease markers. This will help ensure that they can understand the findings and obtain necessary medical attention to address the issues. My research showed that between years of 2006 and 2022, all donors with confirmed positive findings were notified via registered mail of their results and encouraged to consult a physician. However, the research also showed even though 90% of the donors reported that they received the letter, 30% of those donors were confused about the results and did not understand what they needed to do to follow up on their test results. These findings have shown that it is necessary to follow up with the phone call so the donors have an opportunity to ask any questions and nurses can help them and in the process of following up with their test results and receiving treatment for their positive results. The PowerPoint presentation is meant to be used as a teaching tool for the new nurses and current nurses at the donor center so they understand the process of why we're notifying the donors, and it also shows the implementation of the script for each positive infectious disease. There is a script that the nurses can follow, lining out what kind of infection, what are the modes of transmission, and whether or not the donors are able to re-enter the donor pool at a later date, and how to contact the physician. I have chosen the PowerPoint so the nurses have access to the education at all times, and if there are new nurses who are entering the donor center workforce, that they're able to pull it up at a later date. I would also like to utilize multiple answer questionnaire at the end, and also utilize questionnaire at the end of the PowerPoint presentation, allowing the nurses for any additional questions or feedback, how they feel about the education. When conducting the research regarding the donor infectious disease markers and how donors are feeling about it, I used several resources among which were American Blood Centers, Center for Biological Research, and O'Brien's article regarding notifying blood donor centers. All references have been added to the PowerPoint presentation.